For most patients for first-time hip or knee arthritis, we do these surgeries at St. Joseph's Hospital in Towson. The patients are overwhelmingly treated with a spinal anesthetic, and so you're asleep during the surgery, but you have a spinal anesthetic, and the anesthesiologists there are particularly good at this type of anesthetic. And it's really a nice way to get a joint replacement done because most patients can avoid a breathing tube around the time of the surgery. They're not awake during the surgery, they don't remember it, but they don't need a breathing tube. From the operating room, patients stay in the operating room for about an hour to an hour and a half, all told, and then they go to the recovery room. They're there while the spinal anesthetic wears off, and then they go up to their hospital room. And fairly immediately we get patients up and walking right after the surgery, and they're at least walking to the bathroom and to a chair to sit down, and some folks even take a spin in the hall. There's a lot of younger, healthier patients that can be discharged from the hospital the same day as the surgery. And then there's some folks that stay overnight, and it's really dependent on how well they're doing with physical therapy right after surgery. St. Joseph's has a terrific discharge planning team that gets people home and home safe. And when they go home, the vast majority of people have a physical therapist that comes to the house. For hip replacement, that physical therapist is just making sure that you're safe and making sure that the obstacles which would cause you to fall are not in the house. For knee replacement, they're starting getting your motion back in the knee, and so they're teaching you the exercises that you need to do to keep that knee limber. Most patients have a glue dressing on their incision, and so there's dissolving stitches underneath the skin, and then on the skin itself there's a special glue dressing with a glue strip, and so there's no stitches outside the skin that need to be taken out. We used to bring patients back at around 2 weeks after surgery to take their stitches out, but we don't need to do that anymore because of the dissolving stitches. And so most patients come back for an x-ray at about 6 weeks after surgery, and we check to make sure that their motion is doing well and that they're progressing appropriately in their recovery. The follow-up for a hip or knee replacement is that patients come back at 6 weeks after surgery for an x-ray, 3 months after surgery for an x-ray, a year after surgery, and then every 3 to 5 years after that, just to check and make sure that the parts are functioning appropriately and that they're not having any problems. But of course, at any time, if patients want to come back earlier, they're welcome to.